I am in a unique position, a doctor who writes and paints. I enjoy the pleasures and perils of both sides of my life, but it definitely surprises me that I have managed to write since 2014. I am indeed still writing, I am also still a doctor. These two professions have no retirement. That's the best part. But there are perils. Hi, it's Dr. Amrita, and this is Health Well Bridge. A report by ASSOCHAM has some serious food for thought. One of our teachers talked about wanting to leave the world while still working. His passion for teaching and taking care of patients was inspiring. He was 78 in 2013, and the last I know, he's still keeping up with the excellent work. But while doctors' experience and practice gets better with advancing age, the stress takes its toll. As healthcare professionals, we often fail to follow what we preach. Timely, healthy food, exercise, and sleep. Of all three, sleep and exercise are most easily skipped, and the untimely death of healthcare professionals are a big danger sign. India's non-communicable disease burden is growing alarmingly, with the average age of onset falling sharply. I attended a webinar by ASSOCHAM where they talked about a report prepared by the Thought Arbitrage Research Institute or TARI. This was India's largest primary healthcare survey covering 233,672 people in 21 states. The survey was analyzing the rising cases of chronic non-communicable diseases in the country. The prevalence of NCDs in India, 116 per thousand population. People between the ages of 26 to 59 years are most affected. Hypertension, digestive disorders, diabetes are the top 3 prevalent NCDs. Others include respiratory disease, neurological disorders, heart diseases, kidney disorders, and cancers. This is in order of prevalence. Men are more likely overall to get these NCDs than females. But hypertension and neurological disorders are more common in women. Environmental factors are one of the most significant causes of NCDs. This is followed by an inactive lifestyle and poor diet. The top 9 risk factors include air pollution, low physical activity, poor diet, stress, obesity, tobacco use, high leisure activity, alcohol consumption, and lack of sleep. Some or almost all these risk factors we face every day. With time, they add up and take their toll on your body. Prevention is the best cure. You need to take it into your own hands, but some of it requires government intervention. For example, environmental factors like air pollution is not easy to tackle at the individual level. Women and children get exposed to indoor air pollution when they use biomass for cooking fuel. We can do our part, but to make a real impact, the government needs to look into it. The Pradhan Mantri Ujjwala Yojana is making an impact on indoor air pollution. Still, for outdoor air pollution, we need a plan of action. For end-of-life passenger and commercial vehicles, the Registered Vehicle Scrapping Facility RVSF in Ahmedabad will be set up by Tata Motors. The Government of India wants to reduce the polluting effect of older vehicles and indemnify car scrapping if the conditions are fulfilled. That definitely could work. When you talk about stress as being one of the most serious non-communicable disease risk factors, we know that's something all of us face. This is one of the most difficult parameters to measure too. But since we all face it, its effect is far-reaching. Stress can be a problem for multiple reasons. You cannot measure it, but you still feel it. The cognitive symptoms of stress include excessive pessimism, always seeing the bad side of things, poor judgment and focus, forgetfulness and disorganization. Too much clutter and outer chaos is a sign of inner stress. And some behavior indicating stress include pacing, fidgeting and nail biting. Interestingly, stress can show up as a physical symptom too, like upset stomach, headaches, low energy, aches, pains, tense muscles, rapid heartbeat, chest pain, frequent colds and infections. Stress causes a surge of excess corticosteroids in your body, and that can play havoc with your immune system. That's definitely not good. But what can you do? You can eat healthy, avoid junk food, prevent too much of sweet food, have plenty of fresh fruits and vegetables, avoid too much dairy, avoid addictions, sleep 8 hours a day, exercise at least 40 minutes per day, at least so that your heartbeat is pumped up. Moderate level of activity is important if you really want to keep your heart and lungs healthy. Walking at the rate of 4 kilometers per hour for 40 minutes is recommended. But the point is to include it in your daily routine, not just occasionally. Do something which helps you lower stress. It may be a hobby, meditation, gardening, whatever it is. You need to find that out for yourself and do that. Living healthy is not a choice, but a necessity now. Are you living healthy? You were listening to Dr. Amrita on the Health Wealth Bridge podcast.